Hi, everybody. Good evening. Welcome to the Finding You podcast. I'm Dr. Brad Reedy. Today is Tuesday, February 18th, 2025. So, tonight I'm going to be talking about why your therapist needs to be in therapy. It's a provocative title, of course, but I want to talk about why I value that as a backdrop, a foundation for therapists and therapy, both in my own therapy as I go to therapy myself, but also as I train and supervise therapists, how important it is that they do this precious and sacred work of working on themselves, of walking into that room and sitting on the other couch. Before I get into that, I just want to talk about our upcoming announcements and programming. Our next Finding You is an online option, March 14th through 16th. That's half the time of our in-person Finding You at about a third of the cost. So if time and money are at a premium, that's a great option. Our next in-person that I will be running, I'll actually be running this one, is March 19th through 23rd. So if you're interested in participating in a Finding You with me, March 19th is your next option. I run a couple of these a year. April 23rd after that. And of course, you can go to our website for more information to learn about all the upcoming programs. We have an attachment-based therapy class, a master class. This is designed for clinicians, for those in the mental health field, if you're a mental health practitioner. If you need continuing education credits, this offers 6 of those. This will be March 7th, 9 a.m. to 4 p.m. Mountain Time. And then the next iteration of my conscious parenting workshop will be April 11th, 9 to 4 Mountain Time. We're also going to be hosting a Finding Connection workshop. That date out soon. That's coming up here in the spring of 2025. For any inquiries to sign up for, to learn more about, if you want to come up with a customized, tailored program for you, for your family, for your partnership, you can always email us all things Finding You at info@findingyouprograms.com. That is info@findingyouprograms.com. So with that, let me just talk about my perspective on why therapists are so much better off than therapists that go to therapy are so much better off than those who don't. I've said this many times, but when new therapists come to me and ask me about advice or training or workshops or certification or models, the thing that I say invariably is the number one thing that I have found in my experience that you can do to better your therapy is to be in therapy yourself. Like I mentioned at the outset tonight, to go into the therapy session and to sit on the other couch, on the other chair, and to have that experience. Just like I say to parents, if you learn nothing else from the experience, there is tremendous value in knowing what it's like to feel what it's like to be on that hot seat, to be in that position. When parents send their children to programs or their spouses, they through some kind of boundary, encourage or facilitate their partner going to a program, and they ask me for advice, they ask me for perspective, I often say to them, go to therapy, do your own work. It changes your relationship to the problem. It changes your relationship to the person. It allows you to remove yourself from a dynamic that is often invisible, often outside of your conscious mind, and how you're participating in the problem or in that dance together. Now, while I say this to new therapists, really I say this to old therapists, you would be shocked to find out how few therapists that I run across in my career that are actually regular participants in psychotherapy. It is a small minority of therapists. And for me, that loses some credibility, some trust. In fact, a lot of the excuses that they have or the reasons that they have for not going to therapy illuminate for me that how they misunderstand that what therapy is. I don't see therapy as a place to go only in crisis or only when you're having a specific problem. Those are times, obviously, when therapist is a huge asset and resource to the participant. But I see therapy as an ongoing practice. I don't understand when people talk about being graduated from therapy. And oftentimes what I will say is when a therapist initiates or graduates somebody from therapy, it is because they don't know how to sit with somebody when there's not a crisis, when they're just sitting with them and listening and waiting for that person to explore the deeper recesses of the self, to look at themselves, to find themselves. I love the practice of therapy because it's not something I do when I'm in crisis, and I don't always know when the crisis is going to be. I have my sessions, typically 11 o'clock Mountain Time, on Friday. And what I find is I don't know what that therapy session is going to be about until sometimes the moment that the therapy session starts. So I go there as a practice, much the same way that people talk about prayer. If the only time that you pray, if you're a religious person and that's something you do, if the only time you pray is in crisis, I'm not sure you're taking advantage of that resource either. So therapy for me is a practice. It's a discipline. It's a way of being, and at least it's a reminder of my position in this whole project. That I'm not an expert that is here to tell you how to live your life. My expertise is not in telling you what to do. Rather, my expertise is in providing a context, a container, an experience where you can discover your own truth. And a lot of that is by you doing the talking and me doing the listening. So often in my career, I've been in a position where I've heard therapists talk about this idea that parents need to do their own work. In fact, that is in large part where the base of the followers that I have on my social media and on this podcast come from originally, although it's spread out from there. That is the foundation. That's kind of the source. Children in treatment and their parents. And therapists will often get very frustrated with how difficult it is to encourage a parent to go into therapy. I think I shared recently that I was asked or discussed, I had this discussion with a colleague where they were expressing this frustration. And after thinking about it for just a short period of time, I said, the way to encourage parents to go into therapy will become clear to you the minute that you get into therapy and make that your practice. It's the exact same microcosm. If parents are better off by doing their own work in terms of their child's diagnosis, mental illness, their own addiction, if that works for them, then the same is true of the therapist, right? It's a similar role. The therapist takes on a parental role, a position of authority. It doesn't mean that they're autocratic in their authority. It just means that they are the one that is the host, right? They're the one, ideally, that is bigger, more expansive than the client, can hold space for them, has enough resources and capacity to hold space and to sit with somebody in their unsolvable problems. And so many of what we struggle with are unsolvable problems. It is the dilemma of living. I get asked this question maybe as much as any question I'm asked. Can I ask my therapist if they go to therapy? And first of all, the answer unequivocally is yes. You can ask your therapist anything. I always say you are allowed or invited to ask difficult questions, and you can expect intelligent answers. When you ask your therapist if they've been in therapy or what their experience with therapy is, for me, the indicator isn't the yes or the no. I'm in therapy, or I participate in therapy, or I have participated in therapy or not. It's how they respond to the question. How is the client left feeling when the therapist answers this question? I think I've told you in the past that in graduate school, that many professors answer this question or helped us with this question. And really what they gave us is ways to deflect, to turn it back to the client, to say things like, that sounds important to you. Why is that important to you? And to just take that discussion wherever it leads, to never answer the question. But again, I think that tendency comes from the fact that the professors that I had in graduate school, for the most part, not all of them, there were a couple that were the exceptions, and they were, of course, my very favorite therapists, my very favorite professors. Many therapists don't go to therapy because, again, they don't understand what it is. They think it's a place to just solve problems. They don't know it's a way to heal the underlying, subtle at times, wounding and trauma that we experience. I'm not talking about big T trauma. I'm talking about complex trauma, developmental trauma, process trauma, the trauma of being in a relationship with a certain type of person, a certain kind of person. And so if you sit in a session with a therapist as the client, and they're going to avoid this question, they're going to deflect, turn it back on you, that leaves you feeling quite empty and vulnerable and exposed. versus the therapist says, yes, I have been in therapist, or I'm looking for one, or I've been in analysis, or yes, I'm in therapy now. For me, unless they have a supervisor, an active supervisor, and I'm not talking about a new therapist here. I'm talking about therapists that have been in practice for some time. Unless they have an active supervision process, I'm not sure that that's something that I would trust. And for me, I use my therapist for supervision as much as any other issues in my life, right? Because maybe more than any task, my week is spent of doing therapy. So my issues are going to come up for better or for worse. So ask the question, please ask the question. How do they answer? How do you feel when they're giving their answer? Do they turn it back on you? I find that this idea that I'm sharing with you today on this podcast is more resisted actually by more experienced therapists. They're more defended. When I train therapists that are older, have 10, even 20 years experience, I find that a much more difficult process because oftentimes, not always, but very often, my experience is that the way that they've been practicing therapy or how they've been taught is something that they will come to realize very shortly is something that was maybe not as skillful as they thought, maybe not as profound as they thought. And if you've been doing something for 20 years and you come to the realization that you haven't been doing it as well as could be done, that's a really hard truth to swallow. But that's what psychotherapy is. Psychotherapy is a place where you go, not just like I've said, to hear difficult things from the therapist, which many therapists think that that's what it is. In fact, a lot of therapists pride themselves on their ability to be confrontive, to tell a client the way that it is. And they seem not deterred at all by the fact that many of their clients quit or opt out of therapy. And they use that as a way to justify, to prop up their own egos and to say, well, I told them the truth. They weren't ready to hear it. When they're ready to hear it, I'm available. But the fact of the matter is therapy is supposed to be something different than that, as I understand it. It's supposed to be a safe place, a place where you feel welcomed, a place where you feel seen and heard. And confrontation is not directed in that way. If you want research on everything I'm talking about tonight, and in many ways, a great source would be, well, anything that Jamie Gill has written, of course, but also the book Motivational Interviewing talks about some of the ideas here today. The idea that confrontation is maybe the least effective method for facilitating or encouraging change in clients. And therapists who haven't been in therapy don't know that. I used to think years ago, in fact, this is something very recent. I'm super sensitive. Still, I am very, very sensitive. I wish more than anything that I could just be sensitive to the positive things in life, just acknowledging the beauty and the sublime, profound experience of living, joy, love. I wish that I was only sensitive to those things. But as I understand it, my sensitivity to those things also makes me sensitive to threats, to pain, to sadness, to hurt, to all of the undesirable feelings. And I can't separate the two out. I can't be sensitive to the one and not to the other. And what that means is that I'm sensitive to shame. I'm sensitive to criticism. I'm sensitive to confrontation. I'm sensitive to somebody giving me feedback from a place that is anything other than love and support and kindness and gentleness. And that's something, this thing that I'm telling you right now about being sensitive to feedback, I have probably said in the course of my life 10,000 times, give it to me straight. I can take it. Don't walk on eggshells around me. Don't soft pedal it. Tell me the way that it is. I said that to my therapist week after week after week at the first several years in therapy, thinking that that was what therapy was, because I knew no differently from my training, from my education. So I wanted her to kind of punch me in the nose with the truth. But the only chance that I had, and I didn't know that then, I know it today, the only chance that I had for the kind of awareness that I was seeking, the kind of connection to myself, to my soul, to my authentic self, to my inner child, to my experiences in life, to my own life. The only chance that I had was to keep going to therapy. That was my only shot at this. So I teach therapists therapy, the end of each session, ideally, doesn't happen every time, of course, but one of the ways that you measure good therapy is that the client feels better, not less pain and sadness and hurt, but better about their pain and sadness and hurt. You can't remove somebody's grief and loss. You just can't. Not in any kind of short order. But what you can do is be with them in it. And because parents, most parents, struggle, and many struggle mightily with sitting with a child and seeing a child, with taking in the child's distress and pain, metabolizing it and reflecting back to the child a sense of okayness, an experience of co-regulating with the child. Because so many parents struggle with that, we need to have that experience to grow in the way that I understand one can grow in psychotherapy. So you can ask and listen to their answer. Again, comparing the relationship between parent and child, or family member and identified patient, and therapist and client, I'm going to borrow from Abraham Tversky's book, Addictive Thinking, a wonderful book on addiction. And this idea is the thing that really left the biggest impact on me. He said the reason that family members of people struggling with addiction is what he was talking about, but the reason that family members, parents, avoid doing their own work are the exact same reasons that the person who suffers from alcohol and addiction is resistant to the process. I don't need help. I can do this on my own. I'm not the one with the problem. The other people are more severe than me. I don't fit with them. I have nothing in common with them. What they're going through, what they're learning doesn't apply to me. My life is going well enough. These reasons for not going to therapy could just as easily come from somebody who is the identified patient, and often those phrases do come from them. And they could just as often come from the parent or the family member, the non-identified patient. Or for tonight, these are the same reasons that one of the time when I asked a really renowned therapist in Utah why he didn't go to therapy, he said, I don't think it'll work. I don't think it works. And I thought, how can you live with providing this for people if you don't believe in the method yourself? Maybe that's the most important reason to go to therapy, is to find out if you believe in it or not, that it can help. And if you don't understand what it's supposed to help, and I really didn't, and I don't think most therapists leaving graduate school know. I think more will know today than when I came out of graduate school, but still, it's a minority of them that understand that safety is the treatment. The resistance is the thing that we are treating. And resistance is that fear of change, that difficulty at looking at the parts of ourselves that we don't want to exist, that difficulty of leaving what is comfortable for something that is unproven and terrifying. And that takes a long time. A long, long time. I think another reason that I value therapists, well, I'll just say this. It's not just about valuing. I've never seen a great therapist who doesn't do their own work, ever. Never. Not once. I've seen very smart therapists. I've seen clever therapists. I've seen articulate therapists. I've seen therapists who are incredibly adept at explaining theoretical constructs and models and techniques. I've seen great writers. I've seen many, many researchers who don't go to therapy. But I've never seen a really, really, really good therapist who has not put a significant amount of time into their own work in psychotherapy. Never. And yet, I will say that to therapists, you can't really, In certain situations, you can't really require a therapist that you're hiring to go to therapy. But when I talk to people about that, when I talk to people in the field that I've worked in, everybody, I think maybe they theoretically agree with me, but very few follow it. When I give my large addresses these days to professionals, this is my message. You go to therapy. Go to therapy. That's everything else will get better. Everything else will make sense. And one thing that you do is you demonstrate that you're always a student. The longer I'm in therapy, the more I realize there is to learn about therapy. I think therapy is complex and nuanced and difficult. It's largely my therapy practice is largely a reflection of my own inner workings and inner world. And it's difficult. And I struggle and I bumble and I fail at it. And I find myself apologizing to my clients for last week's session. I find myself relating to their problems and challenges. Sometimes people ask me questions about a certain topic, and my answer is as soon as I have that answer figured out, I'll let you know. But I don't yet. I too, like you, am struggling. And the great paradox with that kind of sharing that comes from my own work is that people feel safer and they want to come back again and keep talking and keep talking. Jamie Gill wrote in one of her books about this very subject. She said, psychotherapy is a profound experience of living. One experiences things there one is not likely to experience any other place. It makes one a better therapist. It is important to know how it feels to be a patient in psychotherapy. The way to gain this perspective is to enter psychotherapy oneself. Psychotherapists who have not experienced their own psychotherapy are operating with one hand tied behind their back. Why, one wonders, would a therapist of all people avoid psychotherapy? Well, as we mentioned earlier, for the same reason that anybody else does. And yes, these podcasts and the books and the blogs that I write and that others write are wonderful resources. And for me, they are an important invitation to do your own work. And it's not because you're going to get the answer to the question that you're asking. It's because you're going to begin to ask different questions. That's the remarkable thing about psychotherapy. It doesn't give you often the initial answer, but rather it gives you a different question, a different, what I like to call, project. When I started going to therapy as an adult, postgraduate school 26 years ago, when I started going, my thought was, again, it was unconscious. Give me the tools, the techniques, the strategies so that I can, in a loving way, manipulate life, manipulate my family, my children. I didn't think any of these thoughts. I wouldn't have never admitted to this, not to myself, especially with the word manipulate. I would not have liked that at all. I would have used words like encourage, facilitate, support, right? I would have said those kinds of things. Give me the techniques, the model, the ideas that will help me to manipulate my children, my spouse. Because my experience was that they were the cause of my distress and my unhappiness. I thought my struggling children were the cause of my unhappiness. I thought my wife was the cause of my unhappiness. So why wouldn't I look for a resource to help me to change my problem? Because I thought my problem was out there. And now today, of course, I know that I'm the reason for my unhappiness. It may be the result of things that have happened to me in the past, especially in early developmental stages of my life. I'm sure and clear about that. That's where they may have started. But now they are mine. Now they live in me. Now I carry them wherever I go. I had a friend many years ago who has since passed away, died by suicide. A few years after this discussion that I'm going to share with you. And he had a version of this discussion with me many times. He would come to me and he would say, look, I'm a pretty smart therapist. I have a PhD. This was true. He'd been in practice for some years. He said, I know all the answers to all the basic questions in therapy, which He knew the answers to the questions that clients were asking him. He didn't know enough at the time not to answer the questions, that they weren't the questions that needed answering. But on a superficial level, he was right to say that he knew the answers to the questions. He said, why can't I just use these sessions we have? We were doing professional supervision. Why can't I just use these sessions as my therapy? Why don't you just tell me? I can take it. Tell me what it is that I'm missing. And I would say to him, what you're missing is that you need to go do your own therapy. And he would look at me and say, I will accept any answer but that. The only answer I wanted to give him was the answer that he couldn't accept. Like it is said in Abraham Tversky's book, Addictive Thinking, it is like somebody coming to you and saying, what's 2 + 2, but please don't tell me 4. I won't accept that answer. The work is its own reward. The work is about transformation. The work is about experiencing something different than you experienced in the past with a different kind of person. And while I have said lately, I have not said this for my whole career until the last few weeks. I have not said what I'm about to tell you. Finding you is different. Finding you is different. Finding you coaches and therapists are different than most programs I have dealt with, most programs I come into contact with. We believe, we teach, we embody something different. We understand that it's the relationship between the therapist and the client that makes the biggest difference for better or for worse. How I think and feel about you, how I respond to you. When you come with a problem, what's my reaction to that? Do I go into problem-solving mode as is your desire, your request? Am I able to respond patiently, empathically? Am I at a place where I realize I don't have the answers? I don't have the same ideas, values that you have. Do I know that? Do I know that you might value something else in life that is very, very core to you that I don't see the same way? And can I support you to get to where you need to go? This is not a process about becoming Brad Reedy. This is a process about becoming you. And if I'm not in therapy realizing that for myself, I'm not so sure I can remain focused on that. I'm not so sure that I won't and can't fall. I fall into that idea now. And I am working my butt off. And I still fall into that. Really, what this does is it ensures the therapist being in therapy ensures that they understand what's going on inside of them. That's really what it is. I remember one therapist asked at a supervision therapy session with my therapist. She asked, whose feeling am I feeling? She said, I'm not quite sure in psychotherapy whether I'm feeling the client's feeling or feeling my own feeling. And my therapist, teaching at the time, responded by saying, great. And she moved on to the next person. And what she was saying was, that's the right question to be asking yourself over and over and over again. Projective identification is when the client or person, doesn't have to be a client, projects into you a feeling. See, I walk around and I catch people's feelings all the time. I catch my client's feelings, I catch my wife's feelings, I catch my child's feelings. I have my own background too. Transference is how the client feels and thinks and sees you, what role they place you in their lives. Are you the guru, the teacher, the expert, the rescuer, the problem solver, the lover, the magician? What are you? The parent who criticizes, the parent who's anxious and worried. What are you to them? And they will likely engage you in ways that they were taught to engage other authority figures and parents. They will put you in that role. That's the transference. Countertransference is how you respond to the client, how you feel about the client. Are they somebody to be rescued? Are they a damsel in distress? Are they somebody who needs to be taught the way it is? Are they somebody that needs to be punished or behaviorally coerced or encouraged? Are they somebody that is beating a dead horse, talking about the same things, can't get over it, wasting their time going into the past? Countertransference is how the therapist feels about and towards the clients. And there are two types of countertransference. One is personal, which means it comes from my background. And one is diagnostic, which means I'm having this experience with you each week where I'm feeling like you're a helpless person and I need to be the one to come save you. I don't have that the session before you. I don't have that the session after. That's not something I had before we started the last session, but I'm having it with you. That can be diagnostic. That means it's coming from the client. You are taking on the transference, the projective identification, the feeling. You've caught their feeling. And now you're responding accordingly. How can you sort out this difference between personal and diagnostic countertransference without your own mirror? I've shared the quote from Shams Tabrizi, the spiritual teacher for Rumi, the poet Rumi, who said that all of the prophets, all of their advice could be summed up into one sentence, which is find yourself a mirror. Wouldn't that apply to a therapist? To find themselves a mirror? Who's holding space for the therapist? I go because there's 1 hour each week where I can just talk about me. Anything I want. It's the one place, therapy is, that I can't really get it wrong. It's the one place, no matter what I say, the person on the other side of the equation, at least in the therapy that I go, seeks to understand me, not to fix me or correct me. And when I experience the benefit of that kind of love and grace and safety, and when I feel what that does in my body, what I feel when I experience what that does to my issues in my marriage, my relationship with my wife or my children or my clients, all I want to do is have people experience the same kind of thing. It is absolutely transformative. When I feel like I have to defend myself or be good or be right or get better, when I feel like I owe my therapist my gratitude or I owe them my progress, I had that with my mother. I already had that with the adults in my life growing up. I don't need more of that. I need something different. So I go to have that space held for me. And ultimately, if a therapist is not well practiced in their own work in psychotherapy, there's a much greater likelihood, a very great likelihood, that they will project onto you stuff from their own past, their own undone work, their own shadow, their own frustrations. And because they are well equipped with technique and skill, and because they hold a position of authority with a few letters after their name, that kind of projecting onto the client, into the client, is so, so damaging and powerful in a negative sense. Self-work, like I said, it's more rare than you think in therapists. Just as self-work, working on yourself, is predictive of a parent's ability to provide a healthy attachment with the child and subsequent resilience that comes out of that attachment, self-work is also the best thing that one can do to assure that the therapy they provide is adequate to the client's needs. As Gill says, the process requires a therapist who has been able to work through his or her own attachment issues and is capable of creating a secure pattern. Such a therapist is likely to be different from one's parents. Most importantly, the therapist can listen and resonate where the family could not. We are, as parents, at a disadvantage. And I want to be as clear about this as I can. I am a better therapist to your child than I am to my own by a long shot. I have too much wrapped up in my child, too much identity wrapped up in their success, failure, pain, joy, progress. I will stumble and trip with my child much, much more than I will with your child because of all of that. So the therapist needs to go to therapy because that's the most powerful way that they can feel the empathy. And I'm talking to you, listener. If you're a therapist, I've been talking to you the whole time. If you're a non-therapist and you have an identified patient in your family, go to therapy so you know what it feels like. Go to therapy, walk into there so you know what you're asking your loved one, your child to do. Go to therapy as a therapist so you know what it feels like for the client to walk in and how much more kind and warm and compassionate you're going to be when you know how scary it is. I wish there were a way in this country to require therapists to go to therapy. I think it would make the biggest change in my profession. Go to therapy to find yourself over and over again. It is so hard to remember yourself. There's so much pressure, there's so much energy in the world trying to get you to be something else, something the world wants you to be, something other people want you to be. But if you have an adequate therapist, you find yourself over and over and over again. Go to therapy to own your own shadow, your own unconscious parts that you are likely to project onto the client if they're not attended to. It's going to happen anyway. It's just that therapy will give you a venue and a process to go back and own that. Go for supervision. Go to therapy for supervision. And not just a supervisor who's just doing supervision. That can be helpful. I recommend that. But go there to ask your therapist questions about your relationship to the therapist and where that, your relationship to the client and where that has shown up in your life and other places, in your childhood and in your past. Ultimately, you can't take a client farther than you have gone, because if the goal is to become yourself, it's hard to recognize the authentic self unless you've had some contact with your own. It's hard to encourage somebody to be a person when you have so little experience with being a person, being a human. It's hard to recognize an inner child unless you have a relationship with yours. And yes, all of the small brushstrokes are very different for each client everywhere. That's part of what therapy teaches you, is that the therapist meets you where you're at, not vice versa. The therapist comes to you to understand you, to bring your agenda, your theory, your technique, your model, to have that be front and center as a therapist to the client. You are very likely to lose the client, to eclipse the client. Don't be surprised when the client decides to quit because they're all better. They just want to get away from this, from that experience. They've already had that plenty. And I don't think it's something that happens and that has a finish line. I understand there may be periods of time in life where one doesn't go to therapy. When my therapist stops practicing or passes away, I imagine there's going to be a pause for me. There'll be some grief before I find the next venue, the next container, the next safe place for myself. But ultimately, it's just like anybody. You want somebody to change? Go to therapy. You want somebody to stop using addictive substances? Go to therapy. You want your spouse to get better? Go to therapy. You want your co-parent to be a better co-parent? Go to therapy. And keep going. And don't look for the finish line. There's no finish line. There's no end point. Gosh, I'm so glad. How heartbroken I would be if I would have stopped therapy 2 weeks ago, a month ago, 5 years ago, 10 years ago, 15 years ago. How much I would have missed in this process about myself, about the journey, about myself, about who I am. So I think you can ask, I think you can expect it. And that's one of the core principles of finding you, is that our approach is based on and it relies on how much work that we have done. And it's not perfect by any means. But that's not the goal of therapy, is to be perfect. The goal of therapy is to become human. And very few people ever do that. All right, folks. That's all for tonight. My next broadcast will be a week from today. I'll be talking about shadow work in depth. The shadow, it's a Jungian idea. Think of unconscious. Think about the parts of ourselves that we don't like or that we have split off. That'll be Tuesday, February 25th at 6 p.m. Mountain Time. Like I mentioned, the next program is an online program, March 14th through 16th. If you want to do an intensive with me, we have a spot left for our March 19th. Finding You Intensive, April 23rd after that. Our attachment-based therapy class is March 7th. Conscious Parenting Workshop for Parents is April 11th. The Finding Connection Workshop comes up this spring. Any questions, any inquiries, anything, email us at info@findingyouprograms.com. And then my two books, The Journey of the Heroic Parent and The Audacity to Be You, are available on Amazon and Audible. I hope this was helpful. It was a little bit of a different kind of a topic, but I hope it was helpful. Hope it gave you some perspective. And as always, thanks for showing up. Thanks for being willing to look at yourself, to do this work, because you doing the work makes all the difference in the world. Have a great evening, and I'll talk to you next week. Take care. Bye-bye.